Good evening. This is a brief overview to the introduction of psychotherapy. And in this chapter and video introduction, we will briefly just introduce the various types of psychotherapy that have been used in the past and that are currently used today. So let's begin talking about the learning goals and objectives for this introduction. We're going to define psychotherapy, discuss the history of psychotherapy, discuss the goals of psychotherapy, discuss and identify the various kinds of psychotherapy, and discuss cultural barriers to seeking therapy. So, how do we define psychotherapy? Psychotherapy is really not an abstract term. It is an umbrella term that describes the use of many different psychological methods when based on a regular personal interaction to help a person change and overcome problems in many desired ways. It is also defined by the interaction or treatment between a trained professional and a client, a patient, a family, a couple, or a group. And we'll discuss some of these during this presentation. And the problems addressed are merely psychological in nature, and they can vary in terms of causes, what influences them, what triggers them, and how they can be resolved. So, what are the goals of psychotherapy? Explore thoughts, feelings, and behaviors to help a person achieve a higher level of functioning, to help increase the individual's sense of well-being, and to help them reduce those negative symptoms of an emotional or a mental health problem. So this brings us to a discussion briefly of the history of psychotherapy. Before the 19th century, it was practiced by philosophers and spiritual practitioners and other type of healers known as shamans. And in this picture you can see an Indian shaman with tools that he uses to heal people that come to him who believe in him. And this picture you see a shaman from India who is healing a young lady, and these practices are still being done in various different countries. Of course, we don't use spiritual healers as such as a common practice in this country. But by the 19th century, the mental movement came about. They used more traditional therapeutic methods. And here, if you remember, we talked about one of the founders of mental illness or mental health, Philip Pinell, whose primary figure movement for humanitarian treatment of the mentally ill in asylums. And if you remember, we talked about individuals were once placed in insane asylums and they were treated so inhumanely. So when Philip Pinell came along, he alleviated all of this, and he believed that people should be treated with dignity. And he took all the chains off these people who were in prison. He began to treat them as they were sick rather than as beasts or just animals. He took them out of the dungeons and allowed them to walk around freely, and eventually those who had been incarcerated for many years were discharged. And here in our state and other states, it used to be the same way. We talk about Sigmund Freud, who is also known as the father of psychotherapy, who developed psychoanalysis as an earlier form of therapy where he believed that a person could overcome those things that were causing them distress by bringing up the harmful issues through the unconscious mind, and encouraged them to use free association, and they would be placed on a couch as such as you see here, and they would lie and they would associate with whatever came to mind in free association. to come to insights about their unresolved issues from the past that were causing them emotional distress. Then we talk about psychodynamic therapy. And the primary focus of this particular therapy is for the individual to reveal their unconscious content of a client's psyche in an effort to alleviate psychic tension. And this also comes out of psychoanalysis, which tends to be much briefer and less intense. Then we talked about the humanistic approach as one of the modern perspectives of psychology, where humanistic psychologists such as Abraham Maslow and Carl Rogers came up with different techniques to help an individual. And it explicitly concerned with the human context of development of individual with an emphasis on subjective meaning. They believed that a person had potential for positive growth rather than seeing disease as pathology, and that if you remember, Maslow said that a person has the potential for reaching the full capacity, and his hierarchy of needs, those basic needs that needed to be met in order for one to reach that full potential or self actualization. And also, that humanistic approach suggests that depression occurs when an individual is not able to cope with their life problems or their circumstances, which keeps them from reaching that full potential. And this approach also emphasizes a holistic view of the human or individual and giving human beings the power to choose their own destiny. Then we talk about behavioral, cognitive, and cognitive behavioral therapy. Aaron Beck was the founder of cognitive therapy, which seeks to identify those maladaptive thoughts or those faulty cognitions and beliefs and reactions with the aim of influencing destructive emotions and address maladaptive cognitions as well as dysfunctional behaviors. Behavior therapy focuses on behaviors in combination with thoughts and feelings that might be causing them. In this diagram, we see that behavior reinforces thoughts, thoughts create feelings, feelings create behavior, and of course, the cycle continues. And behavior therapists look more at specific learned behaviors and how the environment has an impact on those behaviors. And they try to help the individual come up with different ways and better ways of thinking. Now, Albert Ellis, who came up with rational emotive behavior therapy, is just another type of cognitive behavior therapy in which he has what is called as an ABCDE model, where he says first there has to be an event or an adversity that's causing your problem, and then there's the belief about that event, those faulty beliefs, which causes emotional consequences or emotional problems. Then these lead to the therapist helping the individual dispute those irrational beliefs. And once they dispute these emotional beliefs, they try to help them come up with new ways of handling those irrational beliefs and coming up with more rational ways of thinking. That is rational emotive behavior therapy, or that ABCDE process. Then there's group therapy, which you have one or more therapists that talk to or treat a small group of individuals who share insights on how they handle similar situations. But this is not one of the first options that is offered to individuals because they're sharing private or intimate information with people they don't know. And first, they have to have a trust. So once they build up that trust issue, then they are able to improve not only with the therapist, but by observing other people in the group and receiving feedback from the group members. It helps them develop ways or add new ways of handling and coping with their own behaviors or situations. And there are advantages, but there are also disadvantages. And we will talk about those in the chapter. Then there are biomedical therapies, and specific ones we talk about in the chapter are most commonly used are drug therapies. Here you see a picture of Zoloft, which is an antidepressant, or what is known as an SSRI, and we will talk about these in the chapter and many other drug therapies. Then, decades ago, there was electroconvulsive therapy, which is not used anymore today. Commonly was known as shock therapy, used for people who had severe depression or emotional disorders, and they actually would send shock waves through the brain and put the individual into convulsions, and this was supposedly to help them eliminate that depression, but it proved to be a very dangerous procedure. It's not practiced anymore today. Then they used to do what is called psychosurgery, where they would first take an x-ray of the individual's brain and see what area of the brain was causing them that discomfort, and they would do what was known as a lobotomy, and supposedly they would remove that portion of the brain that was causing the person discomfort, but that proved to be a very dangerous situation as well, so that is no longer practiced today. And we'll talk about many other disadvantages and advantages to using biomedical therapies. Then we have the medical model, which is really the most current practice used today. The medical model, where the patient is seen as pathological rather than they're seen as pathology, which is an illness of the mind. And this is where the therapists use skills to help them regain their health. And of course, the extensive use of the DSM comes out of the medical model, where uh, disorders can be diagnosed, labeled as a collection of symptoms that tend to go together, and people with disorders can be treated, they can be tended to, given therapy, with the goal of restoring their health. And this is where they come up with many treatment plans for the individual. And I will bring to class the two different publications that we've discussed using the medical model. Finally, there's the eclectic therapy or the eclectic approach. Remember when we talked about in the introduction to psychology on modern perspectives, where psychologists use a combination of more than one type of discipline to help treat an individual, and they use whatever techniques that work best with a specific individual rather than sticking just to one type of method, because not all methods work for all individuals. And when we look at the eclectic approach, uh, they are observing the content, body language, um, therapeutic responses, therapeutic relationship between the client and the individual, and the interventions. So whatever works for the individual, they come up with goals and treatment plans using this eclectic therapy. And if you see the diagram, about 36% of practitioners use the eclectic approach, the combination of all these other. And the other highest percentage, 29%, uses the psychodynamic approach, including talk therapy and humanistic approaches to psychotherapy. And then finally, we talk about cultural barriers to psychotherapy. We know that in various cultures, they have different beliefs on how psychological disorders are defined and how they respond to different types of therapy. And this can be sometimes a barrier of them not going to therapy because of what they believe and their background and their worldviews, and ethnic minorities have a hard time going to therapy. And we will talk more in depth about why ethnic minorities refuse a lot of time to seek psychotherapy. So this is just a brief interview overview of psychotherapy, and we will talk more in detail about the specific psychological disorders and how they are treated. Following this video introduction, complete your 10 question video multiple choice quiz.